Do you ever wake up drenched in sweat and just feel miserable because you can't sleep, you're too hot? Well, today we're going to talk about night sweats, what they are and how we treat them. Well, welcome back to my channel. My name is Dr. duPont. I'm a board-certified gynecologic oncologist, and today we're going to talk about night sweats. Now, I've put some videos out on hot flushes and perimenopause and menopausal symptoms, but today we're going to specifically speak about night sweats. So when I see patients who are menopausal and they tell me they're having night sweats, the first thing that I want to make sure is that there's no infection. Now remember, night sweats are also associated with fevers. So if I have someone that had COVID recently or has an infection like sepsis, which is a bloodstream infection, I want to make sure that the night sweats aren't due to an infection. I remember once when I was in high school, I had this really bad respiratory infection, and I remember because it was close to prom and I got my hair done. And my beautician did my hair, it was so pretty, but at night when I went to bed, I was so hot and sweating that all my curls fell out. And I was so sick, I didn't want to go to prom, but I'd made a commitment, so I decided to go. And even though I didn't feel great, I still went. So remember that night sweats are a sign of an infection. Tuberculosis can also cause night sweats, and also infection. So if you think you're having an infection, that the night sweats are due to something other than menopause, then see your healthcare provider. But today what we're going to talk about is night sweats associated with menopause. So when we think about vasomotor symptoms, and that's kind of the doctor term for symptoms that are related to menopause, we think of hot flashes. Sometimes they're called hot flushes because you get flushed and very hot, and then night sweats. So night sweats are usually hot flashes that happen at night. And the reason this happens is because there's an area in the brain that has estrogen and has actually estrogen receptors. There's alpha and beta. When you get to be close to that menopausal range, usually it's 2 years before menopause, well actually 2 years before the estrogen decline happens, you start to notice symptoms in your body, and that's usually related to declining estrogen levels. So what women will normally start to feel is hot flushes or night sweats, and sometimes both. Usually you might have someone that works with you that starts to fanning, they get really hot and they're just like, oh, I can't take it. And it's very brief, it goes away, and those are hot flashes or hot flushes. When you have those at night, you tend to get really sweaty, you want to take your pajamas off because you feel soaking wet, and it's a lot of times it causes sleep disturbance because you're just wet, you feel icky, you can't sleep, you're tossing and turning. And so as a result of not being able to sleep because of the night sweats, a lot of women wake up and they're tired, they're groggy, and at work they just feel sluggish. And so fatigue is another symptom. It's related to some of the vasomotor symptoms that women have due to menopause. So we talked about kind of vasomotor symptoms, hot flushes and hot flashes. Next we're going to talk about exactly why do they happen. Typically when that area in the brain has noticed that your estrogen levels are dropping, there's a thermoregulatory area of the brain, and it notices the decrease in estrogen. Some women, because that region is very sensitive, they just have more vasomotor symptoms, so they'll have more hot flushes and night sweats. How we treat that is usually with estrogen. So if you're not able to take estrogen, let's say you had breast cancer, or for some reason you've had like a history of blood clots, whether blood clot in your lung or in your leg, and your doctor said, no, you can't take hormones, then there are some other alternatives. And we'll talk about that in the next segment of this talk. But just keep in mind that estrogen is usually the best way to treat it, but that we do have alternatives for women that can't take estrogen for other reasons. So some of the treatments of night sweats or vasomotor symptoms, we'll talk about them in different categories. So the first group we'll talk about is dietary and environmental. So simple things that are easy to do is just wear lightweight pajamas, cotton fabrics that are breathable. They do make certain sheets that are very like cooling sheets. There's cotton sheets, there's new bamboo type sheets that are very cooling, and I'll put a link in the below of some of the sheets that I found that are very helpful for women that are menopausal and that are suffering from night sweats. So in terms of dietary changes, weight loss has been found to help, reducing spicy foods, and I think those are the most common dietary changes. But exercise, weight loss, avoiding spicy foods, and also avoiding alcohol have thought to help. And also keeping your bedroom very cold, whether you have a ceiling fan or you're able to lower the temperature on the air conditioner. Keeping the room cool will help you sleep and help you be able to manage the night sweats. So that was dietary and environmental. The next category we'll talk about is hormonal. So the most common treatments are estrogen. So if you have a uterus, remember you must have a progesterone with the estrogen because the progesterone protects the uterus. So hormones would be either, I like to give it transdermal, so creams, patches. There's sprays nowadays. There's lots of different ways we give estrogen. There's also oral tablets. So definitely talk to your doctor because there's risk and benefits of both types. Definitely, some of the transdermal or the creams or lotions are a little bit more expensive than the tablets, but it will depend on your insurance plan and the coverage that you have. So just know that hormonal management is the preferred, but not everyone can take hormones. So some non-hormonal management that I give that I talk to patients about in the office would be things like, all right, so I'm going to talk about non-prescription, non-hormonal therapies. One is simple as acupuncture. Another one is cognitive behavior therapy, which is like talk therapy. Sometimes if you kind of know what the associated symptoms are, you can do like mind-body thinking to be able to avoid some of the symptoms. Hypnosis, clinical hypnosis has been proven to help. There's not a lot of research on that, but it is thought to help. So those are kind of non-prescription, non-hormonal treatments. Other prescription treatments would be things like gabapentin. I use it very often. I tell patients it's a very old drug. It's an anti-seizure medicine, but it's has been shown to alleviate night sweats. Of course, it's off-label, so it's not used for its intended purposes, but it works very well. I use it for my patients that can't take hormones, mainly my breast cancer patients. So there's gabapentin, there's clonidine, which is an antihypertensive. I don't use it very often, but if I have someone that needs blood pressure medicine, one thought was to use clonidine. There's other medicines such as there's Veoza, which is a new one, it's FDA approved. It actually works at the level of the brain on those receptors that are in the thermoregulatory zone, and so it's a new medicine that's approved for night sweats and hot flashes. Other medications are some of the antidepressants. So Effexor I use a lot. Paxil has the FDA approval for menopausal symptoms. And then there's also herbal treatments. So black cohosh, red clover, isoflavone. So those are other treatments that are herbal that you can get over the counter. You can get it on Amazon, and those are thought to help. One of the surgical options is, and I've never had anyone use this, but it has been described and it has been thought to be effective, stellate ganglion block. And that's done by a pain specialist, and what they'll do is they'll inject anesthetic in the front of your neck in the area of these nerves, and that's supposed to help with hot flushes. So that's a surgical treatment, so it's more invasive, but it's not hormonal. And if you've tried many of the others and the simple things haven't worked, then the surgical options is another alternative. So today we talked about night sweats. We talked about what they are, how they're treated. I do have some more videos on menopause, so keep watching, and the next one will go over other treatments and tips and tricks for you to know if you're in that menopausal range and you need treatment. Well, thank you for watching, and I'll see you next time.